It's time to talk about the elusive menopause on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. Hopefully you're watching us on YouTube. If not, then you're listening to us and we are so excited to have you here. If you're a first-time listener, welcome. If you are one of our regular listeners, thank you so much for being on this journey with us. So today we thought we'd talk about menopause.
I like that.
Menopause.
Menopause. Yes. Yay.
That's
menopause.
Right.
Is there a menopause cheer?
Yeah. Yeah, let's talk about menopause. It seems to, it seems to be the unspoken topic. I mean, I know that there's people that talk about menopause, talk about sex and all that kind of stuff. But it still continues to be somewhat of a hush-hush topic that's not really being talked about, and I think that it's something that's really important.
There's definitely not a lot of research that's being put into menopause. I don't know if that just has something to do with the fact that more research is put into men's things than women's things. I don't know. We've talked about that before in the past with friends, but there's just not a lot of emphasis put on these issues that women go through. That it's a natural thing that happens with women. We've had this podcast on the docket for a while now because, I've been starting the symptoms of menopause, and it's just kind of brought up over the last year or so. Just some of the things I've gone through where I didn't even realize that this type of thing comes with menopause, right? Mm-hmm. And so like the things that I was experiencing, not really hot flashes. Every once in a while I'll get a hot flash, like, I don't know, maybe one every other month. It's nothing I know some people that get them multiple times a day and It's very debilitating, but like, that's not really me. Mine comes mostly with like mood swings and depression and sadness, which again is not me. Like I typically do not run depressed and sad. So on mornings when I don't want to get out of bed, it's very confusing to me.
And to me.
Yes, I'm like, what is happening? But yeah, so I'd probably been experiencing that for, I want to say 5 or 6 months before my friend reached out, and she was like, kind of going through similar things. You know, she's one of my friends from college, and she hadn't really told me, like, I had all these conversations with her over those months, and we never really confided in each other about that, which is weird, right? Because we confide in each other about a lot of things, but then that we weren't. But she said that she'd been really down lately, and she wanted to get a group of her friends together to go camping on a weekend. And I was like, okay, let's do it. And so it ended up being me and her and like 4 other of her girlfriends that are all our age. And it was actually a really wonderful weekend because I realized that I'm not alone, right? And I realized that I'm like, oh my gosh, these are menopause things. And like, just putting those two things together and just being like, why isn't anyone talking about this stuff? Like, why don't we talk about this aspect of womanhood and what we could expect to experience when we hit that stage, so that it doesn't kind of freak us out, right? And we're not like, what is happening with me? Because it's normal, right? And once you understand that other people are experiencing the same thing and that it's normal, then it kind of makes you feel a little bit better. And it almost feels like it puts you at ease so much that you have the symptoms less.
Right. Yeah, because I think that the unknown, not understanding what's happening definitely makes you more anxious, because this isn't you, right?
Exactly.
This isn't you, and all of a sudden, all of a sudden you're feeling sad, you're feeling, depressed, you feel like crying all the time, or like you said, not getting out of bed, which is true. Like there have been a few times when, I usually am the first one up and I go and do my stuff, and then I can hear Tina moving around upstairs and I know she's up, but there's been a few times where it is silent. Yeah, no, and it's like, what's going on? Is she okay? I better go check on her, make sure she's still, she's still breathing. Yeah, and so it's I think that unknown and not understanding, and it's so true. I mean, it's not something that's really discussed enough. And so, and believe it or not, time goes by fast. This camping trip you guys did wasn't this year. It was last year.
I know.
And you started kind of going through this over a year ago.
Yeah. Even it was even affecting our marriage because again, I was not being myself, and you were all up on me, what's happening?
I didn't know what was going on. Yeah.
Is there something wrong in our marriage? And I was like, no, nothing's wrong. I don't know. And
it was just so out of character to see her so all of a sudden she'd be la 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 la, and then all of a sudden it'd be like in a dump, down low, or just not really interacting with me. And so obviously I'd be like, oh,
what did I do?
Did I do something wrong?
Yeah.
And it did take me a while because I was trying to figure out how to best support her and understand what was going on.
Before we kind of realized what it was. I think then I went away on that weekend and I came back and I was like, I think this is menopausal, or perimenopausal symptoms. And then it kind of made sense. And then because before we were having kind of not like arguments, but all these little mini discussions trying to process why I was being the way I was being. And because I didn't know and you were frustrated, it was frustrating.
Sure.
Right?
Sure.
But then I go on this trip and I come back and I'm like, oh my gosh, I think this is what it is. And you just got to be patient with me. Yeah. It was a different conversation, right?
It is. And now when I can, now when I see her flip, where I just kind of all right,
just gotta get out of the way.
I'm just gone. I just go and do my own thing now. I'm like, okay, this is my time to exit left, or exit right. But it's oh my goodness, the things that women go through. I mean, first of all, we go through all this pain to have these babies, and it's and of course, when you have these babies, you forget about your pain because these little precious things come along, and then you get to an age where then all of a sudden the body decides, you know what, I'm done. Mm-hmm. We're done. The ovaries are like, yeah, we're out of here, and so women are dealing with different stuff, and everybody deals with different things, okay? Yeah. There's depression. I mean, Tina mentioned hot flashes, sadness, just
not
mood.
Being able to sleep well.
Exactly. Mood changes. Yeah. I mean, for some people, maybe even physical symptoms, headaches, abdominal discomfort, maybe weight gain. Oh, yes, weight gain. Your body composition just kind of changes with a shift in the hormones. Yeah. And so it is scary. Something different is happening with your body, and trying to, first of all, figure out what it is. And like Tina said, once she figured out what it was, it was actually wonderful, not only for her, but for me, because now we could understand, and now I understood that I could support her better by not is everything okay? Did something happen? Did we say something? Did I say something? But be like, okay, I mean, she knows that if whatever she needs, I'm always there, but I also know to give her space. And I think that her understanding what's going on has actually helped tremendously.
Yeah. And you being a woman yourself, we were thinking back, because you're 9 years older, right? So you went through this, and actually I feel like you went through menopause earlier than I'm going through it now.
Maybe.
And I was trying to think back, what did we go through? Like, what did I experience when you went through it? Because you went through it, I don't know, a decade ago now. And I don't remember you having a lot of symptoms, like maybe mood swings, maybe a little bit of sadness. I remember back then, but you didn't really have a lot of sweats. Like, you didn't get hot flashes a whole lot. And
I can count on my hand literally the number. But it was almost like I was like, "Where's my hot flash? Where's my hot flash?" Because I knew that was a big symptom, and I think I had it maybe 2-3 times, and I just remember just basically waking up really hot and kicking off the sheets, but then that was it. I never really had much more than that. I mean, I don't know. I feel like my menopausal symptoms really weren't really very prominent. In fact, I remember continuing to wait and be like, okay, when am I going to get the menopause? And now I'm like way out of menopause. So I mean, every woman is different. I mean, I remember my grandmother talking to me about how she got so, depressed and sad, and even my grandfather was like ready to divorce her, and
crazy, right?
And then my mom really didn't go through heavy symptoms either. Like for the most part, like she kind of pretty much just sailed right through. So everyone is different.
We do have a lot of patients who ask me all the time, like from a wellness standpoint, like, oh, the things you're recommending, will it help with menopause? And yes, I mean, everything we're recommending is going to help the body be well overall. I feel like me taking the supplements, me exercising every day, me eating right is definitely curbing my symptoms, like, because I'm not getting a ton of hot flash. Again, that could just be me. It might not have anything to do with what I'm doing, but I feel like it helps.
Absolutely.
Because even a decade ago, we were doing all of this that we're doing now. We were eating healthier, we were drinking alkaline water, we were exercising, and you didn't have that many symptoms. And I kind of equated that to, we're kind of living a cleaner life and we're moving our body, right? We're getting regular colonics and lymphatics, right? All those things kind of contribute to helping the body detox. So could these things help? Yes, absolutely. Is it going to be the end all be all for everybody? Maybe not, because there are some people that have really bad imbalances of the hormones that no matter what you eat, no matter how much you exercise, no matter how clean the water you drink, you're still going to have really bad hormone imbalances and may require, some type of hormone replacement therapy. And so there are holistic practitioners that I recommend from more of like an OB-GYN standpoint to patients if they get to that point. Like if they're doing all the things we're suggesting, they're better, but they're still not where they want to be, then they go look at their options with creams and pills and pellets and all those kind of things, because there are many women that have had a lot of success with those things. But trying to I feel eat cleaner and exercise are and then colonics, lymphatics.
Right.
Because one of the things that happens when you stop ovulating and you stop bleeding, this is one of the things we learned, is that women now have one less way of detoxing, right? Think of your period every month as a way of the body detoxing itself. So when we go through menopause and we stop having our periods, then we lose that aspect of detox. So we have to replace it with something else. So whether that's going for a lymphatic every month, or sitting in an infrared dry sauna, or going and getting a colonic, those are all really great examples of ways that we can detox to help keep the body working right properly. But trying to incorporate those things, trying to eat cleaner, drink cleaner, exercise is very important when you're going through menopause. And I feel like, especially strength training for the muscles, I feel like a lot of women get depressed during this time, and that depression then leads to, I don't want to do anything. Because for me, I work out right first thing in the morning, and on those mornings where I don't want to get out of bed, it's like, I don't want to work out, right? Yeah. But I force myself to get up and work out because it's so important, again, to minimize the symptoms.
That's right. That's right. Yeah, I agree. I couldn't say it any better. I mean, definitely the supplements, the greens. I mean, we'll never know, but I also agree that probably maybe my symptoms were very subtle because we were eating healthier at that time. And so, your body needs, it always needs those good nutrients because your body is constantly changing. It's constantly healing. It's constantly in a flux of something. There are thousands of chemical reactions going on in your body. And so the more you help it, the better for your health. And so there is no question at all that good nutrition can only help you. Okay. And if you are a woman that's going through menopause, or that it's going to be, you're coming into those years where you're going to be entering menopause, the menopausal phase, nutrition is of utmost importance, and not just through that phase, but forever. Okay. You're only helping yourself. And so nourishment, good nutrition, lots of greens, the detox. I mean, basically the supplements that we have.
Right.
Okay. I mean, again, I'm going to just go through them. The greens, because your body needs greens to build healthy cells, to build healthy hormones, healthy everything. The detox, because it's going to help to clean out your body. You're constantly putting chemicals in your body, and sometimes our body gets overloaded. And even though it's detoxing, because that's what our body does when we poop, when we pee, when we breathe out, your liver is one of the biggest detox organs in your body. So the detox, the enzymes that you take with your meals to help you digest your food that you're eating so that you can actually get the benefit of the nutrients. And then probiotics. Probiotics are great for the health of your intestine. And of course, then we have the super salts, which are the electrolytes that you put in your water. You need those electrolytes. You're losing electrolytes every day, and you need to be replacing them. And also, connect with us. Find us on our website, drlizcruz.com. You can sign up. There's a magenta colored button on the homepage. You can sign up for a free 30-minute wellness consult. Okay? So go to our website, homepage, click the button, and yes, this is free. And this is for anyone. You don't have to be a patient in our practice. This is for anyone, anywhere in the world. It's free and it's done over the phone, so anyone can do this. And this is our gift to you. If you haven't rated us, please rate us and please give us a 5 because it'll help other people just like you to find us faster. And lastly, if you haven't subscribed to our podcast, please subscribe so that you never miss an episode.
And one more thing before we close out. If you are going through these symptoms, find your lady friends and talk about them.
Yes. Yes. Amen to that.
Amen.
All right. Take care, and we'll catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.